You're tuned into the Advocai Health Podcast. We're here to talk about rare diseases, real people, and the ripple effects of change. Stories that move you, guests who challenge the norm, and vibes that keep it real.
Hello, everyone, and welcome back to another episode of the ASH podcast. Today, we're diving into a story that's much about trust and governance as it is about medicine, the fight against polio in Pakistan.
Despite decades of vaccination drives and billions in global funding, Pakistan remains one of only two countries where wild polio virus still exists. Behind that reality are layers of mistrust, misinformation, and difficult questions about how public health and personal choice collide.
To unpack these complexities, we're joined today by Hadeed Hassan, a researcher at the SickKids Centre for Global Child Health. Hadeed has led on-the-ground research in Pakistan exploring vaccine hesitancy issues in community-based health communication. His work on projects such as Super Apu, which is a voice-based platform delivering health information to low-literate parents, has helped reimagine how trust and access can build from the ground up.
Hadeed, thank you so much for being here with us today. Please feel free to introduce yourself and tell us a bit about your background in the health research field.
Thank you, Ali and Omar, and thank you for doing this important work. It's a pleasure to join you guys. So I am from Pakistan. I was born in Parachinar. Maybe you guys know it, or maybe you guys don't. It's a rural area on the border of Afghanistan and Pakistan. I grew up in the tribal districts in Pakistan. I did my undergrad from Pakistan. I did my master's in global health from the Harvard THN School of Public Health. And last year I moved to Canada. And before that, I worked for about 8 years in Pakistan, in both at the federal and provincial level, mostly in primary healthcare, but also in secondary and tertiary healthcare, around access on projects about improving service delivery, access to healthcare, and coverage. Currently, I'm working at the Center for Global Child Health at the Hospital of SickKids. I'm working on maternal, infant, and nutrition growth exemplar.
Thank you so much for the introduction. So, I mean, like you said, you were born and raised in Pakistan, and you spent a lot of time there. So it's glad to know that we have someone who not only is lived there, but has work experience in like health-related fields there and has seen things that happen on ground. And although we are talking about polio in Pakistan, and we'll shift into that, I think it might be important to start with vaccine hesitancy. So Pakistan, as we know, has struggled with skepticism around vaccines for years. And it's not always rooted in ignorance or lack of awareness, but there are deep layers here, talking about the health system issues, misinformation, about the importance of vaccines. From your experience in both research and field work, how would you state like the confidence that Pakistani people have in vaccines today?
Ali, that's a very important question. It's also a very complicated question. When we talk about vaccine hesitancy, normally we just say, oh, people, they don't know what they're doing, and there's a lack of education. But there are many components to vaccine hesitancy, why it exists, and also there is a lot of variation within regions, right? So some regions, the full immunization coverage is about 90%. Some regions there is like less than 30%. So there's a lot of variation. But if you ask me about like the confidence in vaccines and why there is vaccine hesitancy in the country, so in my experience, one of the main reason why there is vaccine hesitancy is the way people perceive healthcare in Pakistan, right? So if you look at from the people's perspective, so for them, healthcare is like you get sick, you go to a doctor, you get medicine, you get better, that's it, right? Vaccines, on the other hand, are preventative measure, right? I go to you, I say, take the vaccine, and it would protect you from this disease, right? And so there is that disconnect, like the way people perceive healthcare and what vaccines are. And so there is people question the need of like, why do we need vaccine? If I'm not sick, why do I need it, right? So I think that's one like key component where there is a disconnect between like policy and how people and the ground realities. The other thing is also like the fear of side effects. So we know that the routine vaccines, if you immunize your child, there are adverse side effects, like fever is one of them, right? So then your child is healthy, you give them the vaccine, and then there is a side effect, right? And they don't know what the vaccine is, the people. So a healthy child now has a fever, right? That seems like, okay, there must be something wrong, right? Then you go to the health facility, right? Because you have to treat the fever. Most of the time, these are public health facilities. Most of them close by 2 p.m., the basic health units, right? And even if they are open, there isn't much they can do. So then you have to spend money from your pocket, right? And then you would question, like, so why should I vaccinate my children, right? There is also the surveillance system. If you talk about the health system is weak in the sense that it doesn't do a good job of keeping track of like women from pregnancy to childbirth, right? And so these vaccines, they have like fixed schedules, right? You have to be at the facilities on certain days, and so again, that's one area where people don't remember, they don't recall, right? And the healthcare workers, maybe they go there, they definitely go there, but there is also like work needs to be done, right? Because it's something, maybe it's important, but like I have to take a day off from my work, take my wife, my child. Why should I do it, right? And there is then misinformation as well, right? You know, there are a lot of rumors about what vaccines do to you. So, I mean, it's basically people's perception, and also they don't understand what a vaccine is. Do they even need it? And then the health system is weak. The other thing is, most of the time when you go to these health facilities, there is nothing, like, you know, even for like, they don't give you anything for fever, and people like and then they're like, okay, there is nothing, like there are no other services, so why should we come here, right? So there is this lack of trust in the health system, right? So there are like, you know, multiple reasons why vaccine hesitancy exists. Like if we study it from the perspective of the people.
Yeah, no, I think is vaccine hesitancy, not just in Pakistan, it has become a huge thing around the world recently. Like it has been a resurgence of people who are more hesitant to take a vaccine.
Yes.
And I feel Pakistan is suffering from that. Can I ask, you said one thing about the health clinics closing at 2 p.m. Is there a specific reason for that? I wasn't aware that they like close so early.
Yeah, so when you look at BHUs, the basic health units, right? And these are at the union council level. So BHUs there are 24/7 BHUs, but most of them, they close at 2 p.m. So after 2 p.m., I mean, for whatever reason, also like there is a lack of staff, like, you know, there is not enough staff, so they can't, of course, do like the whole shift. So you need, and most of the time when you go even the morning shift, there are always like vacancies, you know, vaccinator is not there, or like, you know, so yeah, that's a challenge. Like Pakistan also has like a huge challenge, like dealing with like this shortage of staff.
Yeah.
Yeah, I think you made a lot of really good points, and there's especially since like Ali and I, we studied together in university, and we studied during the pandemic time. So when the pandemic hit, like this whole topic of vaccine hesitancy was, we knew it existed, but we didn't know like how much it could affect people. And I think from a healthcare perspective, something profound you really said is that there's so many factors and things to consider, like, you know, barriers to care, thinking about like the waiting times, or, you know, just, you know, having to take time off for different families, health literacy. These things are not very commonly thought of for the general public. They do exist, but like from a healthcare perspective, they tend to see a lot of these factors too. So I think that disconnect you were talking about is very, very prevalent, and it's kind of expanded a lot over the years, especially since the pandemic time. So, coming
Yeah.
to the pandemic itself, I'm interested to hear how did the COVID-19 pandemic and the controversies around those vaccines itself change people's attitudes towards maybe all vaccines in general, including
Mhm,
polio?
mhm. Yeah. Um, yeah, Umar, if I can just say one more thing about vaccine hesitancy, then I'll talk about COVID.
Sure, sure.
There's also like when we talk about a country like Pakistan, like the law and order situation is really bad.
Mm,
You know, just today there was a suicide blast in the capital, right?
yeah.
And and there are regular attacks on security forces, and there is like huge like insurgent. Some regions there's insurgency, there's like militancy, and then you have to also like look at this into that perspective. Like, do you like these health facilities? You have to travel, right?
Mm,
And so then, if you think about the law and order situation, would you make that decision? Like, would you go? And that's also like a huge factor.
mm,
And like in such a situation, there are like curfews, even in main cities. Every now and then there is a curfew. And so all these things also like this also affects like the immunization coverage.
mm,
That's like another point that we need to keep in mind when we talk about Pakistan and low immunization coverage. But to your point about like the COVID-19 pandemic, so Pakistan, um, the population of Pakistan is relatively young. I think 60% of the population is below the age of 30. It's a very young population. So the impact of COVID-19 was not that severe. I mean, it was not visible as it was in many countries, right? And initially, the response from the government was very strict. Like, we need to enforce lockdowns, which later we knew that that was not practical for a lot of countries, especially for the developing countries. Like, you can't shut down economy. Like, more people will probably die of that than the COVID-19 pandemic.
mm,
So the effects were not that visible. And there was a lot of messaging from the government. And so to people, it was again like, we don't see the problem, right? Like, we can't go out, everything is closed. Why? Like, these like life in Pakistan on a daily basis, it's hard. Like, there are many things that affect you, and then something that you don't see as a big problem, and the government is telling you like, oh, you have to do this. So then again, like people start talking about like, there must be something uh, other than like this being a serious health problem.
mm,
It was like the talk, like because there was a lot of talk, it came from China. So then there was like, oh, maybe the US is like spreading this rumor about China that, all those things. So what that does is then, and then there were vaccines, and then you had to take the vaccine. They were blocking your ID cards, and then you're like, okay, what have I done? It's just a vaccine. I'm perfectly fine. And so why is like the government blocking my ID card, or why can I not go to my office, right? Why can't I go to work? And then so then people are like, okay, like, we are not that important to the government, and suddenly like they want us these vaccines because, and they are telling us it's good for you, which is like true, but like from their perspective, there are a lot of factors. And there were also like, if you had connections, you could circumvent the system, avoid the restrictions, right? If you see that, that is like, you were like, okay, this is not as serious. This is again some kind of a conspiracy, right? So I think all that then, and most people still like on the ground, they think like COVID was just a scam, right? Like it was nothing. It was just something. There are different theories about it. They don't understand it, but it definitely decreased the confidence in like the government, in the health systems, and also like in vaccines in general.
mm-hmm. Yeah, no, that's really interesting to hear because I'm just trying to compare it with like what we've seen our government do here, And I know that the rollout was a little messy when it came to vaccines, especially since it's tied to pharmaceuticals, and there's a whole lobby that comes with rolling
Yeah.
out vaccines and trying to develop pharmaceuticals. So that's why the timelines used to be a little mixed, and there was a spread of misinformation with the increase in social media and things. But to see it from that perspective in like Pakistan, for example, where the government kind of enforced it in ways without actually communicating, and it's just it I can see how that could be perceived. Like, I'm putting myself in their shoes right there, and obviously can't like completely understand what that they went through, like the general public, but to some degree I understand that that could cause like a negative reaction, and that could definitely instill some mistrust. So I'm wondering, in your opinion, do you think that um in the future those problems when it comes to miscommunication, that could be something that could be worked on in the short term? Like, do you think that the government um, could kind of address that in a way where it reinstills that confidence, or is it something that um, requires more effort from the public as well?
Um, that's a difficult question.
Yeah.
Yeah, but definitely yes. I mean, like the way, as I said, like even like when it comes to vaccines, or we will talk about polio in detail and the way they deal with like people who
Yeah.
refuse vaccines. There is a clear gap in communication, right? So the government definitely needs to make an effort to to explain to the people. I mean,
Mm.
the community health workers they have a big role to play. Um, the health staff, right? Um, just from like my discussions with the people, um,
Mm-hmm.
they would when I was asking them about vaccines and they're good for you and all that, they said that we come to these health facilities, right?
Mm-hmm.
Like our child has fever or cough or like we are sick, and the staff is so rude to us, right? They're just like
Mm.
go there, stand there, do this, do that. You know,
Yeah.
they treat us like we're not humans, right?
Mm,
And then if that same person tell you like, oh, okay, on this day you need this vaccine, I mean, why would you listen, right? You
mhm,
would not want to listen. So definitely there needs to be like, they needs to work on coming up with a strategy where the
Mm.
healthcare system, people feel part of it. And definitely that's something, without that, there is no solution to it. Like you have to make people understand like why we are doing this and why they need it. So yeah.
of
Mm-hmm.
course. I think absolutely there needs to be maybe something that can help the public feel trust in the government. And I don't want to stray the topic too much, but I feel like that's more than just in a health related aspect. There's much
Yeah.
been done in or by the Pakistani government that has caused people to lose trust, but that's a whole different
Yeah. Yeah.
conversation that will take forever for us to try to dissect. So I think coming back to what was initially and is, I think, an important aspect of this conversation, which is the polio crisis. We know that Pakistan is currently, I think, one of only two countries, the other being Afghanistan, that still suffer from a wild polio virus crisis, or where polio virus is circulating, despite there being efforts, campaigns, a
Mm-hmm.
lot of persistence to try to eradicate the disease or have people vaccinated. In your opinion, seeing as obviously you have more knowledge of on the ground situations, can you maybe walk us through where things stand right now in terms of polio in Pakistan? Like, if you have an idea of maybe the number of cases, or just, how prevalent it is?
Yeah, Ali. So polio, for the past couple of years, the situation is getting worse. Like it's not improving. Last year, the cases are increasing yearly. Last year there were 74 cases, and this year there has been like 30 cases have been reported so far. So the situation is not improving; is actually getting worse. And then there are also like attacks on polio workers. I mean, I think just in October, I think it was 14 or 15 October, a polio vaccinator was killed and a policeman. So the situation is not good. It's actually, and um, it's a very complex situation. When we talk about polio, like there are many factors, but right now where things stands and what the system is, we will talk in detail about. The factors that are leading to this hesitancy, and why polio is such a hot topic. But right now, the things are getting worse.
I mean, it's sad to see. I feel like it's a virus that I think majority of like I said, majority of the world has been able to control and or eradicate. So it's unfortunate to see that despite efforts, things are still getting worse. And I mean, you mentioned the attacks. I mean, when you talk about attacks on health workers, I think I actually have it here as well. That it was October 14th this past year where a police officer guarding and the polio vaccine team was attacked and killed by suspected militants. I mean, it makes you wonder why. Like, that can come kind of into our next question is that with all these attacks, have they, in your opinion, these have been going on for a long time, or do you think there is more recent?
No, the attacks have been going on for a while now. Yes, and it like thinking about like the health workers, operating in these environments, right? I mean, like these attacks are also like concentrated in certain regions, so it's not like it's throughout the country. So there are like clusters where these attacks are happening and where most of these cases are happening. But just like thinking about these polio workers, and they're not getting paid that much. How can at max they're getting like 1,000 rupees a day extra, which is like $5. And then you have a policeman with you, with a gun, and you are in a street, you're going to these populations, trying to convince people to vaccinate their children. And all that does is give you more visibility, right? You have a policeman or two, they certainly cannot protect you from an ambush, right? So these are incredible people, incredibly brave people, to go out there to work in such an environment. But it is unfortunate that this is happening, and this has been going on for such a long time.
Yeah, and I think it's very eye-opening as well, because I feel like living in the West, we have this privilege of at least having that sort of access. I know there are barriers in certain communities, but like to have workers like that who are doing it in places like Pakistan, like it really opens your eyes, and also it's humbling in a way for us as like the general public. Like I think we are so attuned to like the lifestyle here that we forget that there are people who are literally risking their entire life and body just to serve healthcare and ensure that other people's bodies are safe. And that's something that we can learn from. Like I feel like those people shouldn't be forgotten, they should actually be remembered. And the more recognition they have, the more we can do as people who are far away to actually like help and make a difference. That's something that we still have to work on. I feel like we haven't made much progress on it on a global scale. And I know that some people, when they look at the polio situation, some people criticize the fact that polio gets like a lot of focus when there are so many other diseases and services that are underfunded in that area as well. So just in your opinion, how do you see that? Like, what is your opinion on that type of tension? Do you think it's valid, or is it something that's skewed?
No, Omar, in their world it makes perfect sense, and I'll explain it to you. So if you think about polio in Pakistan, right, and we mentioned that last year there were 70 cases. Now, from a policy point of view, like polio is something, the vaccine it's easy to carry, it's easy to store, it is easy to administer, and it's a perfect opportunity to eradicate a disease. So it's a lot of cases when the entire world has eradicated it, right? But if you think about it from the perspective of people, like Pakistan is a country of like 220, 30 million people, right?
Yeah.
70 cases. If you put it into perspective, from a policy point of view, from a public health point of view, that's a lot. But for the people, they don't see it, right? It's not like kids are dying of all sorts of things, right? There are diseases that has a bigger burden, right? The financial cost and the life cost is way bigger than polio, right? So now if you think about it, and so to your question about like the disproportionate focus on polio, right? Now polio is like there are a lot of rumors around it as well, right? That this is some kind of conspiracy. Although I would make a point here about like when we talk about conspiracies, and sometimes there are good reasons for them as well, right? For rumors as well. So in 2011, in Abbottabad, where Osama bin Laden was hiding, the CIA ran a fake hepatitis B vaccination campaign to collect DNA samples. Right? It was a fake vaccination campaign. News got out, right? And it was like people, of course, like if somebody tells you like there are like foreigners who are running these fake vaccination campaigns, right? And there are like already like misinformation and rumors around it. That doesn't help. That actually makes it worse, you know. So there are like different elements to that as well, but there are like a lot of like misinformation, and then vaccine, polio causes this, polio causes that, right? In that environment, right, you don't know what it is. When people say that actually they make you sick, right, and it's a conspiracy. You are living, for instance, in a village, right, in the mountains. There are no roads, no electricity, no basic healthcare services. But every month on the 5th, you get these vaccines. It doesn't matter whether it's raining, it's snowing. If they cannot transport it on cars, they will use mules and donkeys, right? But they will come to your village. Now, if somebody comes and tells you, the government clearly doesn't care about us. We have nothing. There is not even a basic healthcare center. Why are they giving us these vaccines? You know, we don't even see it. Why these drops? And if they tell you that there must be something going on, right? They're not telling us the truth. You would listen to them, right? In their world, it makes sense, right? There's so much focus on this one disease. It also like takes away resources from other programs, you know. The vaccinator is on polio duty, you know, so the routine immunization is not happening then, right? LHV is on polio duty, then her other duties are not happening, right? So there is like that tension and that discussion, and for good reasons, that why so much focus on polio, and that definitely sort of manifests in like this vaccine hesitancy and negativity around polio.
Yeah, I mean, I can understand. Definitely, you have to put yourself in the shoes of the people who are living there to understand maybe why they are hesitant to trust, you know, governments, especially when you hear stories about fake vaccine camps just to swab or gain DNA. At the same time, I can also understand the alternative, which maybe is from the government side of polio is easily eradicable. If we put in just enough and convince people to get the vaccine, then we can move forward from it. Don't have to worry about it anymore. But when you're living in an area which is suffering from so many other things that seem so much bigger than polio, and your government is focusing on polio rather than those things, you're obviously wondering why. You know, I mean, I feel like even us sitting here, I remember before we've had this conversation, before I really knew a lot about the issues of polio in Pakistan, and I had heard that, you know, polio vaccines are being pushed. My first thought was like, it's such an easy thing. Why wouldn't people take the vaccine? And then second thought was, when I realized how much, you know, effort and money is going into it, I was like, I thought to myself, well, there's so many more issues. Why aren't they also, working on that? So I think definitely you have to sort of put yourself into the situation a bit to see where both sides are coming from, and then ends up once again becoming an issue of trust, where the public finds it hard to trust what the clinics, government, etc. is portraying to them, and so that creates it's a perpetual cycle of they're not they don't trust this, which then leads to maybe more cases and so on. So
yeah, it's definitely also like, I mean, of course, it's a problem of like information. Like there is a lack of education, lack of awareness in these communities, right? And the government, like, I mean, as you mentioned, like it can be eradicated. And also like for the government on the international stage, it's an embarrassment as well, So there are like good reasons from the policy point of view as well. And there is a lack of education, but like, you have to put it into perspective.
Yeah. And I'm glad you brought up that point of a lack of education, because that's actually kind of what I was going to ask about next, where we've talked about misinformation or, lack of trust, but then is there also areas where information voids exist? So lack of education is what's being a huge factor and in this situation. And do you think that maybe that should be a focus in terms of trying to, instead of like going door to door and try to convince people for taking the vaccine, start from more of a ground level of educating people about vaccines more slowly so that they feel that they know it more and then they can trust it? I think maybe the call's frozen.
Definitely.
Sorry, you froze for a minute.
Oh, I'm sorry. I don't know.
No,
you're good now.
No, I mean, when we talk about polio and this lack of education and basically why people are behaving in a certain way, right? So there are groups, there are religious elements who are constantly telling people in these regions that these vaccines you shouldn't take them, right? They are haram, right? You shouldn't take them. There are rumors around like they causes infertility, right? I mean, people have told me like, oh, we used to see like 12 kids in every household. Now there are like just like 2 or 3, right? So and they think this is because of vaccine. Yeah. They connect it to things that, I mean, you would be like, how, right? I mean, so there are a lot of rumors going around. Like people do not understand. Like, I mean, the communities were telling me like when they come to us, right? They do not explain to us what it is, but at the same time, that is also very tricky. I can see from a policy point of view, right? If people believe that vaccines, they cause diseases, right? It's basic. Now, what is a vaccine, right? If you talk about polio, what is a vaccine? What is in the vaccine? It is basically the virus, but it's weakened to a point that it would just get an immune response, right? So it brings immunity, but it is actually a very weakened form of the virus, right? It is very hard to explain that to them. Like if you tell them, they're like, exactly, that's what we are seeing. Why are you giving us the virus, right? So there are many issues around education, but I think when we talk about like polio, there are many different things that are going on, right? From the point of view of the people, I mean, we mentioned like there is so much focus on polio, right? There is an anger at the lack of other healthcare services, and there is also there are also like questions around like the use of force by the state, right? So I would go into first like the different components, like but how people see it, and then we can talk about like finally how we can sort of educate people or how we can create a system that works. for the policymakers and for the people. So when you go into these communities and when you talk with these people, right? So the vaccine hesitancy, sometimes it's just a response. People are angry at the lack of other healthcare services, right?
Mm-hmm.
And at the same time, when you've put so much focus on polio, they can also use it as a bargaining tool. Sometimes you would see people, they would say like, if you do not do this, we will refuse polio vaccine, right? Because they know like you care about it. So they'll like, I've seen like certain communities have asked for certain things, like if the government does not listen, then they would say we will refuse polio vaccines. But at the same time, like if you refuse polio vaccine, the government would send police to your house. They would arrest you, would put you in jail, right? So it's deeply humiliating for these people. And it's like, oh, what have I done? Like now I'm a criminal for refusing vaccines, right? That's like another issue. At the same time, like sometimes there was an issue with schoolgirls. They got like polio vaccines. It was psychological, it wasn't real, but with all the misinformation going around, there was an adverse reaction. There were videos, and it was all over social media, and this happened in Peshawar. And so there was like girls were like fainting, they were rushing them to hospitals, and then people were looking at all these videos of what's going on, right? And then the polio campaigns, they like happen so many times. Like there is like over vaccination happening, like, they don't want to miss like any children. So like there are so many, they're like, is there a need for it? We talked about like the problem with the healthcare staff and their attitude. People are like, they come to our houses, they don't explain to us what vaccines are, but they are interfering in our household affairs. They're talking about rishtas, they're like talking about matches, they're asking about our kids. We don't know about them, but they know about it, right? So there are different themes when we talk about polio. It's not just misinformation, and so when we talk about a strategy, we have to like think about all these different components. It's not just a question of education. It's basically, you need a system, a comprehensive system that is basically taking care of other things as well, and not just polio.
Yeah. No. That's a lot of points, and I think it makes complete sense. It's a multifaceted issue, and you can't just look at it from one angle. And I think that's the problem that we see, especially in the media, and especially through critics who are seeing it through different lens. They also take in their experience, right? So they're gonna see it through that lens rather than all these other themes that you've talked about. So that's definitely very eye-opening and informative, so thank you for that. I know we're getting close to ending our episode, so maybe we can end off with just one final thing very briefly. You can just say what's one policy reform or maybe system change that could make a real difference for both polio eradication and vaccine confidence more broadly?
Yeah. Umar, as like I think I mentioned this, I think the change in policy is like, people need a healthcare system, a primary healthcare system that is functional, that's working for them, that they feel that they are part of it. It's not just like vaccines or not just polio. Polio should be part of like a healthcare package, a broader healthcare package. That would sort of build trust in the system. You go to a health facility, staff is friendly, you get other services, you would listen to them, and then you can sort of like push back against the misinformation, right? But if you go to a healthcare facility, there is no doctor, stray dogs are roaming in the health facility, and there are so many problems. You don't get any relief, right? And, like, you can do anything. You can then go to them, talk to them about vaccines, but it would not work. So I think the policy change that Pakistan or like the developing world needs is like, we need a functioning, strong primary healthcare system that is basically not just focusing on immunization, but it takes it takes care of you from pregnancy to childbirth
Yeah.
and 2 years of life. And if that can happen, I am certain that people would be more open to accepting vaccines, including polio.
Yeah, I agree completely. And I think that is something we need globally, where a primary care system that you feel encouraged to talk and ask questions and they answer them. And that's something I feel even Canada is lacking as well as Pakistan and other places. Maybe Pakistan, I feel like at times people don't even go to a primary care physician as much. They go straight to, for example, Al Khan University or hospital, which is a tertiary care hospital. You don't expect to have brand new patients asking those type of questions, but that's where people end up. And I think Canada also has similar issues where you go to a primary care physician for basic issues, but patients don't really ask questions, or they're not educated about the issues with the doctors. They're more or less just come in, here's my issue, here's your potential treatment, next patient. And that becomes problematic. And it'd be wonderful if we have it from a thing of like from motherhood to child to birth and beyond, so that way it fuels the whole like next generation and people are more trustworthy of the healthcare system regardless of what country they're in. But I think now, as we're coming to an end to our conversation, and an absolutely lovely conversation, I must say, I would actually love to talk more about it, although and I think we're reaching a bit of a limit, unfortunately. But we've seen the story of polio in Pakistan, and it's not just a virus, it's an issue about trust, to some extent, access, and a complex relationship between the people in Pakistan and the systems that are meant to help them in their lives.
Yep.
Yeah.
And as we've heard today, ending polio requires more than vaccines, as Hadeed said. It demands empathy, equity, and an honest reckoning with the fears and frustrations that shape public health.
So if you found this episode meaningful, please share it with someone who cares about health and humanity. Don't forget to like, follow, subscribe to the ASH podcast for more conversations like this that take a look beyond just headlines. Thank you, Hadeed. Thank you again for this lovely conversation. And everyone to listening, we'll see you next time.